Educating patients about leukemias and lymphomas is pretty challenging. The blood cancers are generally less common than many other cancers that people are more familiar with, and there are dozens of different subtypes. So lymphoma is not one thing, leukemia is not one thing. So it's challenging to explain to patients about lymph nodes and bone marrow and stem cell transplants, but I really enjoy that and am able to connect with patients in a way that'll make those complicated ideas understandable to them. And I can also reassure them that they are in the best place. They may have seen other oncologists before, they may have had other treatments before, but oftentimes they leave their appointment with me saying, I understand things better now than I ever did. And no amount of reading on their own is ever gonna replace what I can explain to them, given my experience and understanding of these complicated cancers. I'm amazed and excited by the progress that we've seen in the care of blood cancers over the past just 10 years. There are patients I'm curing today that I know could not have been cured if they were diagnosed more than a decade ago. And it makes me really excited and hopeful for what lies ahead. Continued improvement in our treatments, precision medicine, where we can really tailor the treatment to the patient and the patient's cancer as we understand more and more about the genetic mutations that are unique to each cancer. Really, the best part of my job is the time I'm sitting in the room with a patient to get to know them and to be able to educate them about their diagnosis and our treatment plan. Of course, it's really scary to have a cancer diagnosis. Sometimes patients are coming to me when they're newly diagnosed with a leukemia or lymphoma. More often, their diagnosis happened with another oncologist and they're coming to me to learn about a stem cell transplant or CAR T-cell therapy, and certainly that's a scary thing to hear about. And so I always start by getting to know the patient. It's so important for me to understand where they live, who they are, what they do for a living, what their family structure is like, because all of those things impact their experience as they go through their cancer treatment or their stem cell transplant. I feel like I'm a teacher there in that room, explaining to a patient what their cancer is and what our treatments are like and why they work, maybe a clinical trial option or different ways we could go. Then I need to explain all the different possibilities so that I can partner with the patient to figure out which treatment is going to be best for them. I didn't always know that I wanted to be a physician. Nobody in my family is a doctor, so I didn't really have that personal experience with it. I really arrived at medicine because I liked the science. I was in labs in high school and college. Some of those labs were focused on cancer cells and understanding what makes a normal cell turn into a cancer cell. And I thought the science of that was all really exciting and something I wanted to pursue by going to medical school. And it really wasn't until I got into medical school and started to have interactions with patients that I realized the lab stuff is interesting for someone else to take care of. I really love taking care of patients. And so as I went through my rotations in my medical school training and my residency training in internal medicine, I came back to oncology. And I've also been really fortunate to have my oncology career develop during these decades of amazing progress in cancer therapies. And so to see the advances happening, so many of them coming straight out of research and clinical trials being done here at Siteman Cancer Center has been really rewarding and exciting. I decided to focus on the treatment of blood cancers and stem cell transplant therapies, really because I was here at Washington University, where blood cancer therapies and research have always been amazingly strong. I have the best mentors and colleagues here. This is one of the biggest stem cell transplant centers in the country, and it really has been for many decades. And so it was a obvious choice for me as I went through training at this place that's always been so strong in blood cancers for me to go into those fields as well. Siteman and Washington University have been on the forefront of so many breakthroughs in cancer therapies. So exciting to be at the place that really started cancer genomics and started the whole revolution in understanding the mutations in cancer cells and how we can use that to find new therapies and take better care of patients. This is a place with outstanding nurses and hospital facilities. It's just a terrific place to be able to take care of patients and do research and always be on the cutting edge and offering the best therapies to patients.